All right, I want to go ahead and welcome you to the clinic. Super excited to be on this journey with you. The first thing that I want to do today is explain the light therapy, setting up the device, how it works, and how to use it. So this is a core light, comes in a box like this. When you unbox it, of course, there's some items in there. There are some glasses. This light is not going to be harmful to your eyes as long as you're not staring at it like this, but the glasses honestly can make looking at the light a little more comfortable because it does flash depending upon the frequency used. So those are there for your use. The light is this device here. It comes with the power supply, which I've already got plugged in. The power supply just plugs into the side like this. So setting up the device is very simple. The cool thing about this device is there are lots of settings which allow the doctor to tailor what he or she thinks you need best to get better, but we're going to start you out where we need to start and begin. So this first button here is a timer. When you push it, it's going to default to 10, but we're going to set that timer to 5. That's a 5-minute timer. Once we start the device, it will treat for 5 minutes. Every area we treat or tell you to treat or prescribe for you is going to be treated 5 minutes, 1 time per day. The next is the frequency. This is how many times the light flashes per minute. So you push the button and a bunch of different choices there, but the one that we're going to hone in on is 40. And then we come over here to this button. This is just the intensity of the light. So we want the light at 100% of its capacity, so we set that until it is at 100. Now, when we turn the light on, it's very bright. You're going to see that on the camera, but there's this little button here that says R and N. That stands for red light and near infrared light. When the red light is active, you'll see a little red dot here. When the infrared is active, you'll see a little green dot. We're going to use both, so we end up pushing this. This will turn it on. We're going to push it 3 times, and you can see that both the red and the green light are going, and of course there's a countdown there. So I'm going to go ahead and shut it off, but this times out automatically after 5 minutes. Once it times out, you don't have to set all the parameters again. You just come in here and hit the R and the N button until both those light up, so we have red and infrared, and it will go on to treat the next area. So I'm going to go ahead and just turn that off. So as far as the setup of this device, you want to use skin contact or as close to you as you can get, as comfortable as with any type of device. These aren't made to be stepped on or bear weight, so please don't do that. On the back, there are these little kickstands, which can be very useful to help set the device up in different methods. I'm going to show you how I like to do it. We're going to use this larger kickstand right here. And when you're treating, I'm going to go ahead. Now, when you treat, you're going to want to make sure that your foot is bare. I'm going to do it with a sock on today, but it's going to be your bare foot. So when we're treating the foot, we're going to put this keypad towards the top because it's very sensitive. So if you touch the keypad, it's going to alter the parameters. If it does, it's no big deal. We just go back and set the initial parameters. You got a 5-minute treatment time, frequencies on 40, we're at 100% intensity, and we're using red and infrared light. So you'll press the buttons, go ahead and start the machine. And when the machine starts, you're just going to rest your ankle on the floor, let the rest of your foot relax up there. Again, that kickstand's not made for weight bearing, so we're not going to put all of our weight onto it there. We're just going to let the heel rest on the floor, rest of the foot there. So for most patients, doctor's going to be having you doing 5 minutes on the left foot and then 5 minutes on the right foot. And then we'll treat the back of the calves. So back of the calves, we're going to use the kickstand as well, just like this. Sitting in a chair, you're going to go skin to skin. Obviously, we're not touching it, but we're right up next to it. So you would start the machine on that 5-minute cycle and let it rest like that. If you're treating the hands, good news is for most patients, unless you're a basketball player, for most patients, we're able to put both of our hands on like that, so the hands are a 5-minute treatment time as well. Most of the time, what we're going to do is break it up. If you're treating only your feet, you'll do, or only the lower extremity rather, you'll do your feet in the morning, back of the calves in the afternoon. If you're treating and having neuropathy in your hands, you may treat your feet and your calves in the morning and your hands in the afternoon. How you do it is completely up to you, but we're doing 5 minutes per area prescribed by the doctor, 1 time per day. Obviously, you're going to get a booklet with this. use our instructions. We've got the research, the data, we know what to do, but there's some good information on here, particularly contraindications, warnings. Obviously, you've got coaching and access to the clinic, so if you have any type of flare-ups or you find that something's strange, let us know. There are some parameters that we can tweak on this to make it comfortable, especially in the beginning as the body is starting to try to clear things out and heal. So that is the core light, and appreciate you taking the time.
On each side, make sure they're just in the water. Your feet don't have to be touching them. And then you're going to get your gloves. So this is going to be your conductor gloves for your hands. And what you're going to do first is you're going to get just a regular water bottle and spray the inside just to make it a little damp, and on the outside. And then you're going to connect the other lead to the glove itself. So there'll be a little black piece here. You're going to slide that in again. And sometimes you have to twist it around a little bit. So once you spray with water, you'll use that conductor spray, like I said, to spray the inside, the outside, just to make them damp. You're going to put your hands in. Sorry, you getting there? And then you're going to turn the unit on. So you'll turn one side on, it'll be for your feet, and the other side will be for your hands. You never want to go past a 5. Even if you're not feeling it, it's still working and still sending that signal from your brain to the nerves. So you want to just set that on 5. Your hands might not need as much. You can always make that a little lower. And you're going to run that for the first 2 weeks. It'll be for 15 minutes. And then after that, it'll be for 30 minutes, 2 times a day. Once you're done with that morning session, you'll want to just lay these out on a towel and then lay your pads out on a towel just so they dry out, and dump that water out. Make sure you turn the unit off each time you use it so it'll save your battery, and then it'll reset. Gloves, once a week you want to rinse these out. So everyone usually has a sprayer over by their kitchen sink. You're going to disconnect the lead, and you're just going to rinse this with some warm water, not hot water, just warm water. Just spray it down. You'll see maybe like a residue come off. That is from the conductor spray because this is salt based. And what you want to do is you can just kind of go down and glide so you get some of the water off, but you never want to wring these out. You never want to put these in the washer machine either. There's wires in here, so you don't want to damage those. Once you've rinsed these out, just let them lay and dry. About once a week you want to do that. Make sure with the unit, you never get the unit wet. It's very important that this unit never gets wet. Of course, your pads and your gloves will have the water, but make sure this always stays dry.
Hi guys, I'm going to show you how to use your nerve plate. You should have received it in the mail by now. When you open it up, you will just plug it right into a wall outlet. From there, you can turn it on with the switch on the back. It'll light up red. And then what you're going to do is rest your feet on top of it. Wait about 30 seconds and it will go ahead and turn on. You'll feel it. We want you to do this at least 3 to 5 times a week for approximately 10 minutes.
All right, so now it's time to learn how to use your Neuropathy Premium Nutrition Support Kit. So it comes in a nice little box like this, and you're going to open it up. First thing that you're going to notice is there is a guidebook in here. The guidebook is going to tell you exactly how to take each one of these nutrients and what those nutrients are actually being prescribed for. So if you look in the guidebook here on this page, page 6 and page 7, it's going to list those nutrients and how to use them. Also in the guidebook, page 9, 10, 11, and 12 are going to talk to you about what type of nutrients that you put in your body that can help you recover faster and get your body healing better, and what type of nutrients can actually be negative and slow down the recovery. So pay attention to this. Everything you need is in this guidebook. If you're a person that likes to do things by paper, there is a daily checklist. It'll tell you exactly what you need to do when you check this off. Otherwise, we'll be keeping track of this electronically. So on to the products. This one right here, this says VasoPro Plus. This is a pink powder. There's a scooper in here. You'll take 1 scoop of this twice per day. This one, these are neuroprotective greens. It's a greensberry drink. There is a scoop of this. The scooper sizes are different. You'll do 1 scoop of this twice per day. Most people will take cold water or juice. If you're diabetic, make sure it's a juice that's sweetened with stevia. If you're going to do a low sugar juice, you'll take 1 scoop of this, 1 scoop of this, and you can mix that together and drink that. And you'll do that again twice per day. A lot of patients prefer the taste of it if it's been refrigerated. So if I'm taking this in the evening, I've already made that after I took my morning dose. It's sat in the refrigerator, so it's nice and cold. Next thing here you have is Inflamex. Inflamex helps to reduce inflammation. This is a homeopathic extract. You're going to take 2 dropperfuls, not the whole pipette, but 2 squeezed bulbfuls. 1, 2. You're going to take 2 droppers full of this in your mouth. If you want to do it under the tongue, you can. If you want to put it right in the same drink that you make, go ahead and do that. But I need 2 dropperfuls of this done, the Inflamex, twice per day. Last but certainly not least, there is a topical here called NeuroSoothe. This is going to contain a little bit of menthol, can help to calm down some of those aggravated nerves, but it is a topical vasodilator with arginine, so it's going to help to open up those blood vessels, get oxygen and nutrients down to those nerves when they're aggravated. So a little bit of this goes a long way. A pea-sized drop once or twice per day can really make a difference, especially, if you have trouble sleeping at night, you'd want to do that right before you went to bed, or if your neuropathy wakes you up at night, have this by the bed. Word of advice on this, because it has menthol, you want to make sure you wash your hands before you touch your eyes, use the bathroom, or anything like that. Folks, that is the Neuropathy Nutrition Support Kit. Easy peasy.
Hi, I'm Taylor. I'm the health coach here at Aligned Health and Wellness. As you begin your peripheral neuropathy program, I want you to know that you're not doing this alone. I'll be checking in on you every 2 weeks for your coaching calls. These calls are a chance for us to connect, talk about how you're feeling, and make sure that you're comfortable and confident with your treatments and supplements. We will also go over dietary recommendations and talk through what to expect as your body begins to heal. If you ever have questions, concerns, or run into any challenges along the way, that's exactly what these calls are for. My role is to support you, help keep you on track, and make this process as smooth and successful as possible. I'm here to help you get the most out of your care every step of the way. I look forward to working with you and being a part of your healing journey.